Hi, this is Dr. Mercado here, Orange State Dental, your local dentist in Downey. I get a lot of questions about dental x-rays, what they are safe, all that. So I want to spend some time answering some of the most common questions I get on dental x-rays to better help your understanding of them. So plainly said, simply, a dental x-ray, it's x-ray radiation. Kind of doesn't sound very safe or very friendly there. But a dental x-ray is a tool we use to diagnose and take care of teeth. So dentists take dental x-rays about every 6 months. Now this varies. So it can be 6 months. Some recommendations go up to 2 years. It just kind of depends on case by case. So if a patient or a person has a history of disease or other problems in their mouth, they may take x-rays more often, so every 6 months. If you go, months and years without any problems, dental problems, you can go up to a couple of years without needing x-rays. But for the most part, you're looking at about every 6 months when you need it and take x-rays. So the purpose of the dental x-ray is a couple things. One is to see how things are going well. So a lot of things we get caught up with x-rays and we're looking for the bad, but really it shows up on the x-ray are the good things, right? That's one. The other side of it is, we use x-rays to actually find and look for things that are going wrong in the mouth. So it could be cavities, could be other infections, could be disease. That's pretty much why what we use dental x-rays for. So as far as dental x-rays are concerned, there's a variety of them. They're all the same. It's all the same thing. It's just the size of it. So we take dental x-rays, for example, for a single teeth or maybe 2 teeth at a time. We also take x-rays for certain parts of your jaw, so larger sections of your mouth. And then we actually also take x-rays for your entire head or entire jaw to see everything for the most part. So that's kind of the thing. It's about 3 different kinds of x-rays, and they just depend on the size of the x-ray. Question-wise for x-rays is, are they safe? I get the concern because it is radiation. We can definitely say it's radiation, but like anything else, it's kind of dose dependent. So if you drink too much, if you get too much sun, it's always bad, right? So a little bit of anything is not too bad, and that's what happens with dental x-rays. The x-rays you get with the dental office or in the dental office are very, very minor. Right. For the most part, living on Earth, you are exposed to more X-ray radiation than what you get in most dental offices in taking X-rays. So it's actually very, very safe to take dental X-rays. So one of the things that dental X-rays show is disease. So we're looking around for cavities, infections, and whatnot, right? The other thing dental X-rays show is actually the healthy parts of your mouth. So we see things and parts of your mouth or your teeth that look good, and we can see other X-rays. So one thing that dental X-rays show, and it's mostly the after effect, they can show the ravages or the damages of periodontal disease / gum disease. So we do use dental x-rays to diagnose and sort of treat periodontal / gum disease. Very common that dental x-rays are covered by dental insurance. That's one of the things they do cover. Now, it is limited sometimes because dental insurances tend to want to cover x-rays as minimum as possible. So some will try to cover it every 2 years. But again, it's a case-by-case basis. So in your case, if you need x-rays every 6 months because of your history, dental disease, your insurance might not want to cover it. But for the most part, in general, they do cover the initial exam and the initial x-rays. So you should schedule a dental exam at least every 6 months. And I say at least because if you go longer than that, that's kind of gives it more time for things to get worse as we go along. So every 6 months, you definitely schedule an exam. So I hope I was able to answer your questions on dental x-rays. If you have any more questions or you need an exam where you would take x-rays, give us a call here at Orange State Dental. It's 562-659-7246. We're here to help.